It's Health Watch time. We want to check in with Sarah.
Sarah.
All right, thank you both. Often, when Dr. Oz wants the latest news on cellulite reduction or other enhancements, he turns to leading aesthetic plastic surgeon and beauty expert, Dr. Haideh Hirmand. This morning, Dr. Hirmand is here at Fox 5 to show us the latest procedures for patients who want a more natural, youthful look. Now, of course, this is very timely because everybody is talking about Renee Zellweger and whether or not she had, plastic surgery, and she says no. Beyond that, we don't know, and that's her business. But, with this current session, everybody's looking at the eyes now and wondering, what should I do that would be more natural?
Right. And this is, as you say, very timely, in general, very timely. The truth is, Sarah, that everyone wants to look their best self. They want to look natural. They don't want to look different. And the eyes are, in fact, the centerpiece of the face. And that's where we often see the first signs of aging. That's where everybody looks first. That's the biggest complaint I get from my patients. And actually, what I most commonly hear is, "Mo, my mother had her eyes done, that she never looked like herself. I'm so afraid." So there's a real fear of looking different, looking like someone else or not like yourself. And I think the eyes are really the place where it kind of shows. And we, like you said, we even see it on the red carpet, and people are tweeting on Facebook how kind of disconcerting it is. So the secret really to looking not different, looking like yourself and looking natural often is in the eyes. It's in preserving the shape of the eyes.
Okay, and I know you have some pictures that we want to show right now of different eyelid shapes, because we don't realize perhaps that all of us are different and there are different shapes. If we could put the first one up there. What are we seeing here?
So the shape preserving eye lift is really an approach that I developed over years. And the first component has 3 components, but the first component is the upper eyelid shape. Now, many people may not notice this or know this, but there are many different eyelid shapes in the upper eyelid that are beautiful. The top is a deep shadow space. The middle is an average, more like mine. And the bottom is someone never had a shadow space. Now, the look of the upper eyelid really determines the look of the eye. So anything that's done in surgery or with injections or anything has to preserve this. Traditional approaches don't really focus on that. And that's how inadvertently you can really change the shape of someone's eye by changing that. The second component, and if we can look at the second picture.
The eye shape.
The eye shape itself, exactly. Like, for example, you have very prominent, beautiful eyes. I have more deep set. So if you look on the left,
that's
you will see prominent, very poppy eyes. The middle is more average, more like me. On the right is more deep set, even deeper set than me. So this combination of eyelid shape and eye shape really is where the secret is to preserving the shape and the look of the eye and the look of the face, thus, if you're doing surgery, if you're doing anything else. Now, for example, in someone with very beautiful prominent eyes like yourself, if you take too much off from around it and tighten it too much, then inadvertently, again, the shape of your eye, instead of almond shape, starts looking more rounded.
And then I won't look like myself.
Then you won't look like yourself. And then, and that's obviously a problem. And lastly, it's supporting the lower eyelid, and that's something we do with a special suture called the canthopexy suture to make sure that the lower lid stays exactly where it is. It's like an insurance suture. So we have these new concepts and approaches in doing an eye lift. And another secret is how to combine that with non-surgical, more, non-invasive techniques.
Do a combination.
Correct. And I did bring a picture of a patient of mine who kindly let us show her picture, who had a shape-preserving eye lift, but also had some non-invasives. And on the left, again, you see someone who has a shadow space that's average. It's not too deep. It's not too shallow. You see it. She has eye bags. She has loose skin. And she had a shape-preserving eye lift. But then she had injections of filler in the hollows with the tear trough procedure, when you actually put the filler in the hollows around the eye. So she had a combination therapy, what I call combination therapy, and doing that in the correct dose, not trying to overdo one. Some people think, oh, let me just do fillers, but they really need surgery as well. So it's really about combining it in the right dose.
How often do you have to do it? How long will it last?
You mean the injectables?
Or both, the surgery and
the surgery often once in your life.
Okay.
The upper lid, again, if you want to do shape preserving, you may need more than once, but it's well worth it to keep looking like yourself. The fillers around the eye really last for a long time.
Okay.
And again, as you had mentioned also before when we were talking, it's really important that it's appropriate to your age.
For your age. Dr. Hirmand, thank you so much for coming in and talking about this. How timely, you know, that we're talking about this with what's going on with Renee Zellweger.
It's my pleasure.
Thank you
Thank
again,
you.
Allison, and over to you.